Okay, good evening. So this is your first class about OET. Okay, so in this class I will explain you the basics of OET that you should need to know before start your practicing. Okay, so one thing, like that OET has four modules: reading, listening, speaking, and writing. Okay, so all the modules are very easy. Okay, this one. Okay, all the modules are very easy, so you don't have to worry about it because you are belongs from medical professional. So this is all related about medical profession. Okay, so first we will discuss about what reading. Okay, reading is equal to 350 is equal to B grade. What that mean? What is the meaning of this? Like if you are a medical professional, if you want to work abroad, so if you want to pass your reading module, so you have to get 350 scores in your reading module. That means 350 score is equal to B grade. B grade is equal to 350 scores. Okay, same thing. So if you want to pass your reading, you need to get B grade or 350 scores in your reading module. So in reading module, you have 1 hour. 1 hour. If you want to if you have to complete your reading module within 1 hour. If you want to pass your reading, you have to complete your reading within 1 hour. Okay, so you only have 1 hour during your exam to complete your reading module. So what the reading module includes? It includes part A is equal to 15 minutes, part B is equal to 45 minutes. Okay, what that mean? What is the meaning of this? They will give you a paper like, and they will start timer 15 minutes. Okay, that means you only have 15 minutes to complete your reading part A. Okay, so reading part A includes 20 questions. 20 questions. So what that mean? You have 15 minutes to complete your 20 questions, and after your 15 minutes they will collect all everything about part A, including questions and answer sheet, and then they give you a new answer sheet that include part B and part C. Sorry, I forget to write here part C. After reading part A, they will give you a new sheet that include part B and part C. So you have 45 minutes to complete your reading part B and reading part C. So reading part, as we know that reading part A include 20 questions, reading part B include 6 questions, and reading part C include 16 questions. Yeah, so totally you have 20 plus 6 plus 16 is equal to 42. Wait a second. Yeah, so reading part A 20 questions, reading part B 6 questions, and reading part C 16 questions. So you have 1 hour to complete. You have to complete your all 40 questions, 42 questions, sorry, in 1 hour. Okay, so if you want to pass your, if you want to get 350 scores, if you want to get B grade, you need to get 30 corrects. 30 corrects. Okay, if you want to pass your reading exam, you need to get 350 scores is equal to B grade is equal to 30 correct. 30 questions correct. Okay, so same thing, like if you want to get, if you want to pass the exam, you need to get 350 score. If you want to get, if you get 350 score, that's 350 score is equal to B grade. If you get B grade, that's is equal to, you got 30 questions correct. Hope you understand what I'm trying to say. Okay, it's a very easy, so don't have to worry. Okay, so now we will discuss about listening. If you have any inquiry, you can text me. Okay, and now we will discuss about listening module. Listening module last for 35 to 45 minutes. Okay, so your listening module lasts for 35 to 45 minutes. Even it is 35, 38, 39, 40, 41, 42. It lies in that. So okay, so same, you have 42 questions and three part A like reading, part B and part C, and you have 35 to 45 minutes to complete your part A, part B and C in listening. Same thing, if you want to pass your listening exam, you need to get 350 scores. Same thing like listening, sorry, reading. 350 score is equal to B grade. B grade is equal to 30 questions correct. Same thing, same like reading module. Okay, so same thing. Okay, so reading part A includes 24 questions, reading part B include 6 questions, and the reading part C include 12 questions. So these 24 questions about filling the blanks, these 6 questions are MCQs, and these 12 questions are again MCQs. Okay, this is blanks, this is MCQs, this is MCQs again. So same in reading part A. Reading part A, these 20 questions, reading part A, sorry, reading part A, B, C, 20 questions, 6 questions, 16. These 20 questions are blanks. These 6 questions are MCQs. And these 16 questions are again MCQs, same as listening and reading. Okay, so what is the best thing about this exam? Why it is best than IELTS? Why? OET exam is best for medical professionals, the students or who have done study in medical, because the reading that you will have during your exam all about medical. You will get all the topics in A, B and C about medical, not out of the topic. Okay, in listening same, you have in listening module in all the parts you have conversation about medical topics, not out of topic anything, all about medicine, all about the medical. Okay, so in IELTS we during our exam we will not sure about what topic we will get in our exam. It is about business, it is about anything, movies, songs, any engineering, anything. In IELTS we don't know what topic we will have in exam, but in OET we know that we can't say, we can't guess any particular topic, but we know that the all the topics that will in our exam all about medical field. Okay, so this is the best thing about, so the OET, this is the best thing about OET. And the next module is, writing module. Writing, you have 45 minutes to complete your writing. So if you want to pass your writing, you need to get 300 score. Okay, so it is easier than if you want to pass in writing, it is easier than reading and listening, because in reading and listening you need to get 350 scores. If you want to pass reading and listening, or even speaking, if you want to pass your reading, listening and speaking, you need to get 350. But if you want to pass your writing, you only need to get 300. Okay, 350 is equal to B grade, 300 is equal to C plus. Okay, you have to pass to 3. If you want to pass your writing, you need to get 3. So 300 scores. Okay, so but think in writing. So writing, in this 45 minutes, you they will give you a case note. The case note include a history of patient, and their medication, their treatment, and you have to write a referral letter, or even a discharge letter, or even a transfer letter to your recipient. This is simple. We will talk about it further when we start our classes. And the next thing is about speaking. Speaking is last for about 30 minutes, we can say. Okay, 30 minutes. And in this 30 minutes you have to complete 2 role play cards. Okay, first they will ask you some introduction question, then they will give you a sheet. In that sheet, some information about nurse and patient. In speaking, mostly, if I can explain you in a simple term, in speaking there is a conversation between nurse and a patient, so that's why we called it role play card. So in that situation you have to, you will play the role of the nurse, and your examiner will play the role of the patient. Okay, so this will happen 2 times. Okay, so that's why your role play lasts for 5 minutes. First they gave you a sheet that include your role play card, and then they start the recording. After 5 minutes they stop you. Okay, and again, after your first role play card, they will give you the second role play card. Then they again start 5 minutes, and after 5 days again start recording, and then after 5 minutes they will stop you. And in both you will play the role of the nurse, and your examiner will play the role of the patient. So this is a little conversation. This is a 5 minutes long conversation with you and your examiner as a nurse or a patient. So this is all about reading and listening, speaking and writing. Okay, if you have any inquiry, you can let me know in the chat, or if you have any doubts. So first we will clear it, and then we will move to the next thing. So take care for now.